Good afternoon, everyone, and thank you for joining MHPA today for our Webinar Wednesday series. My name is Patrick Kaur, and I am MHPA's Director of Membership and Partnership Engagement. I'd like to take a moment and provide a brief introduction for today's webinar. Today's presentation is in listen-only mode. If you have any questions, though, throughout the webinar, please enter them in the Q&A section located at the bottom of your screen. Our presenters will address those questions at the end of the presentation. The webinar slides will be available upon request from the presenters. You will also find a recording of this webinar later on this week from the YouTube channel for MHPA. You'll receive a link there as well. We highly, we really want you to participate. It's very helpful. So please do ask questions. I would like to welcome and thank Catherine McPherson, VP of Product Strategy and Development, Chief Nutrition Officer with Mom's Meals, Pedro Cachon, Manager, Case Management with Simply Healthcare Plans, and Julie Aiken, Senior Director, Strategic Partnerships, also with Mom's Meals. Thank you to MHPA Silver Partner, Mom's Meals, for presenting today's webinar, Enhancing Maternal Health with Home Delivered Meals. Mom's Meals has always been a longtime supporter of MHPA. We really appreciate their continued expertise. Maternal mortality rates in the US are among the highest in the developed world. Today, Medicaid pays for over half of all births nationwide, and a high-risk birth can cost 5 to 10 times that of a normal birth. To improve maternal outcomes and lower costs, some health plans are supporting expectant mothers in new ways, including through food assistance. Nutrition plays a role in healthy fetal development and the health of the mothers as well, particularly for members with a nutrition-dependent condition like gestational diabetes. And with that, I'm excited to turn things over to Catherine, Pedro, and Julie.
Great, thanks, Patrick, and thanks everyone for joining us this afternoon and spending time to talk about a really important topic. I know we're here in the month of May, the month of Mother's Day, so we'll be celebrating some mothers and how we can really support mothers have a healthy pregnancy and healthy delivery and healthy postpartum period. So I'm going to do a bit more of an introduction for those we've got speaking today. I am joined today by my colleague at Mom's Meals, Julie Aiken, who's the Senior Director of Strategic Partnerships, where she manages enterprise relationships between national and state managed care organizations to address food insecurity and management of chronic conditions with medically tailored meals. Julie has a combination of 26 years in healthcare, including clinical, contracting, sales management, and business development experience. I'm also joined today by Pedro Cachon, who is the Manager 1 of Case Management for Simply Healthcare in Florida. Pedro works tirelessly in the field along with his team of case managers with a mission to reduce infant mortality rates, low birth weights, premature deliveries, and neonatal ICU admissions locally and regionally. So thanks so much to Julie and Pedro for collaborating on this webinar today. I'm going to start also with a brief introduction to Mom's Meals. So like the mission that Pedro spoke about in his introduction, Mom's Meals is also a mission-driven organization. And so we work across the country with various types of partners. We work directly with managed Medicaid organizations. We work on Medicaid waiver programs. We work with D-SNP programs, Medicare Advantage. We work directly with hospitals and health systems. We work with state and local governments, could be area agencies on aging, or we have a robust private pay program as well. So really any kind of healthcare partner, Mom's Meals will work around their nutritional needs. We are the only national provider of refrigerated, medically tailored, home delivered meals. And refrigeration is really important to the taste, texture, and quality of food. Our food is not frozen. We have grown to over 2,100 employees, and we are also proud to say we have grown to more than 50 to even 60 million meals delivered annually. So today we deliver about 1 million meals a week or more to all 50 states and all US territories. Our programs include those for adults and people with disabilities, aging or remaining independent at home for as long as possible. Our post-discharge programs to help people rest and recover after discharge from an inpatient stay and prevent that readmission. And also our chronic care management program. And finally, our maternal health program, which we're going to focus on today. So let's start out by talking about nutrition's role in pregnancy. So good nutrition is a part of every pregnancy. However, there are certain types of pregnancies or conditions of pregnancy that can be particularly impacted by nutrition. So some of those circumstances would be if the mom has gestational diabetes or diabetes that's developed during her pregnancy. There could also be pre-existing diabetes. That could be type 1 or type 2 diabetes that the mom has before she becomes pregnant. Preeclampsia or high blood pressure developed during pregnancy, hyperemesis or that really extreme morning sickness or nausea, obesity, other comorbidities like heart disease or any other condition that a woman can have, the prescription of bed rest for a safe and healthy pregnancy, multiples. So if someone's expecting twins or triplets, they do need extra nutrition. Behavioral health, we certainly know that depression, anxiety, substance use disorder, severe mental illness can have really impactful consequences on birth outcomes, and nutrition plays a role there as well. And then finally, breastfeeding. So health of mom, health of baby, supported by extra calorie consumption, that's critical. So a maternal health nutrition program can help mothers maintain that healthy diet and adhere to any condition appropriate eating guidelines as recommended by their provider. And this can be particularly difficult when mom is also facing unmet social needs, like access to healthy food. So diet and nutrition, we talked about the many ways they can affect pregnancy, whether that's a healthy pregnancy or a pregnancy where the mother is coping with added conditions. However, add on top of that difficulty accessing healthy food, and it becomes really challenging to follow any nutrition guidelines. And this lack of balanced meals can create risks to mother and child. We know that limited access to nutritious food affects health. So with regard to birth outcomes, we know that skipping meals can lead to preterm birth, for example. We know that not enough nutrition can lead to a low birth weight baby, which can add cost to the healthcare system. And we'll talk about some statistics around that. Good health during pregnancy also influences that postpartum breastfeeding for long-term child development. And finally, there are specific chronic conditions and diseases that are associated with pregnancy complications and the rise in maternal mortality. So specifically diabetes, obesity, hypertension, and cardiovascular disease. And we will do a lot of focusing on diabetes today. So let's start there, talk about gestational diabetes. So every year, about 2 to 10% of pregnancies in the US are affected by abnormal glucose regulation. 90% of these are linked to gestational diabetes or diabetes that develops during pregnancy. The prevalence rates vary by racial and ethnic background, with Asian Americans, Hispanic Americans, Native Americans, and Hawaiian and Pacific Islander individuals have a higher rate of gestational diabetes than white or Black Americans. And we know that gestational diabetes is also influenced by BMI, and we see higher rates of gestational diabetes with higher body weights as well. And next, all of this can come with a cost. So we know that about 6 to 7% of US pregnancies are high risk today. So these contribute to increased risk of C-sections as well as NICU admissions, and that is what drives the higher cost of delivery. And you can see kind of that difference in cost of delivery. A normal birth is about $30,000. Still, that is not inexpensive, and we know that Medicaid does pay for over 50% of US births today. So $30,000 each for each delivery that's still a pretty hefty price tag, but it's about double that when there is a high risk pregnancy. So we're really trying to help as many moms have a normal birth outcome as possible, both for the clinical impact, impact to mom and baby, but also for the cost of care, which we all share. And finally, 75% of all dollars spent for newborn care goes to the care for infants in the NICU and the neonatal intensive care unit, where that real intensive care comes into play. And that's, a lot of the expense. So if we can help mom make it to full term, which is defined as 39 weeks of pregnancy, that's kind of that sweet spot. So you can see the average length of stay in the hospital for 39 to 41 weeks is just 4.9 days. So that's what we're looking for. And the average hospital charges about, right about that $30,000 mark. So that's the lowest risk, the lowest cost delivery. You're just reaching full term. So preterm births, if you're 32 weeks or before, 32 to 33 weeks, average length of stay really goes up, could be 20 to even 40 or 50 days. That's a long time in the hospital. And the hospital charges really reflect that. So $100,000, $200,000, $300,000 bills for that long hospital stay, and even more. We know that, there are some NICU visits that can be, almost $1 million or more. So we're really trying to help mom make it to full term and deliver, with the lowest possible length of stay in the hospital. Everyone wants to get home, enjoy the new family member, and also, limit the costs that go along with that. So let's talk about maternal mortality and what we're seeing. We are seeing increased rates of maternal mortality in the US. And so, let's look at when women are most impacted. When are we seeing, death around the perinatal period? So 38% of deaths occur during pregnancy. 45% are occurring at the end of pregnancy to 6 weeks after delivery. So that's the most critical time, just that perinatal period, during delivery and just after. And that's why that, postpartum follow-up to the provider, which is that quality measure, is so critical. And then just 18%, 6 weeks to 1 year after. We know that women of color are disproportionately impacted by maternal mortality, with Black Americans having the highest rate of death in the US. So over 47 US deaths per 100,000 live births. And we know that older women are experiencing, more maternal mortality risk as well. And then, what are the conditions that are leading to these really devastating outcomes? Heart-related problems are the leading cause of maternal death. So cardiovascular disease, very high, endocrine, blood and other disorders, infection, hemorrhage, and heart muscle disease are right there, kind of at the top as well. Okay. And so this is not going unrecognized, luckily. So our lawmakers are saying, we need to do more. We need to do more to support maternal health. We need to bring down the maternal mortality rates, and we need to allocate more resources to this vulnerable population. This is preventable. We know that these deaths, many of these deaths are preventable. So in looking at federal policies that have been introduced in this Congress, there are a bunch, which is great to see. So a bunch of new policies being introduced that support women around the time of childbirth. And one that is very comprehensive is the Black Maternal Health Momnibus Act of 2021, which is like, one bill that incorporates a lot of policy initiatives underneath it. So there's a House bill, it's HR 959. So if you'd like to go out to look at that online and support it, you can. There's also a Senate companion bill, which is S346. So this is supported by Representative Lauren Underwood in the House, who's a nurse by training, and then Senator Cory Booker in the Senate. They are the sponsors of these original bills, but they do focus on a lot of ways to support maternal health, particularly around decreasing mortality. So with that, I am going to turn it over to Julie to focus on, what health plans are looking at with regard to these programs.
All right, great. Thanks, Catherine. And we really want to just talk a little bit about the value of nutrition during pregnancy. and the value for both members and then also, like Catherine mentioned, for health plans. So we know, speaking to some of the things we've talked about a little bit already, is just supporting that healthy fetal development, making sure those babies can be delivered at term, also reducing health risks and complications for the mom and baby, even after delivery. And you think about a complicated delivery and then trying to go home afterwards and trying to support not only your child, but yourself and your own recovery. Having the supportive nutrition after your delivery can be just as important, even prior to delivery, if you have a condition like gestational diabetes or you have preeclampsia or something like that. In addition, just facilitating adherence to dietary guidelines, like conditions with diabetes, it's difficult for people to know, if you've been diagnosed with gestational diabetes, it's something that's new to you. You're not quite sure, how am I best going to balance my diet during the day? How can I best, manage my blood sugars, before meals and after meals? How can I spread out the carbohydrates through the day, along with balancing, the good fats and also, the proteins and things like that that are so important. And so having these meals provided can be very important as far as having direction, good nutrition during pregnancy and of course afterwards as well. It also promotes hemoglobin A1C levels. It promotes blood pressure control, and then it addresses the social determinants of health, such as, food insecurity. But we look at food insecurity from a lot of different angles. We look at it from the idea of the perspective of not having food around, like a food desert, but the other part is just food swamps. There's a lot of food around, but a lot of the food you might see on a corner, you'd have, Carl's Jr. and a McDonald's and a Taco Bell. And so all those choices are there and they're actually low cost, but they're not the best choices for helping to manage a condition. And then also outcomes for health plans. So we know it supports that holistic approach to maternal and child health. It also lowers the cost of both pre and postnatal care through minimizing that high cost utilization of emergency transportation, EDIP observation, and NICU visits, as well as it impacts the highest risk, hardest to engage members. Oftentimes, providing nutrition can be a great way to engage with members. And I'm excited to have Pedro present some of the data from their wonderful program that they're doing. And then also just driving that postnatal HEDIS measure, which is super important. And just nourishing, both current and then future members of the world, just those babies coming into the world. And then when you look at just some potential maternal health program criteria and benefit design examples, we wanted to provide you with some ideas. And so when you look at health condition support, the criteria could be members with diabetes, it could be gestational or pre-existing diabetes, also preeclampsia. The nutrition benefit can be 2 meals per day for 24 weeks, longer if it's medically necessary. And these types of programs are best for supporting healthy full-term delivery. We also have programs we work with where they provide postpartum support. And the criteria for those members is they may have delivered a baby within the past 2 weeks and they're released from an inpatient hospital stay. In addition to that, the meal benefit can be 2 meals per day for 4 weeks and then longer if medically necessary. And this type of program is best for supporting nutrition for new mothers receiving and recovering from delivery, but also for those who are breastfeeding. What we're finding nowadays is there's a lot of health plans that actually have active lactation programs as well as breast pump programs. So these types of programs support the nutrition that's so important to increase, to have healthy breast milk production for those moms that are pumping at home. In addition, you can see health condition and postpartum and household food insecurity support. So for instance, in this particular program, you have members who have the chronic conditions such as diabetes or preeclampsia, and they require some postpartum nutrition support, but we also know that they're struggling with food insecurity. And so sometimes we want to provide meals for those dependent children and other family members, because we know that a mom may be wanting to provide meals for herself, but she may then, if she's just given the meal on her own, she may want to, offer that meal to her child. So providing these providing meals to the additional family members is also a great way to support folks. And so this can be 3 meals per day for the duration of pregnancy and 8 weeks post-delivery. And again, unlimited family members can benefit from this particular type of program with a value-added benefit. And it's best for those new mothers with chronic care needs living in very food insecure households. So with that in mind, I want to pass it over to Pedro, who will talk about the practice of having these types of programs in place and the great program that they have with Simply in Florida.
Thank you, Yuli. Good afternoon, everyone. Simply Healthcare Plans is a managed healthcare organization here in South Florida. We were acquired by Anthem in 2014, and we serve Floridians in the following programs. We have MMA, long-term care, Florida Healthy Kids, and Medicare Advantage. It was founded in 2009. We serve more than 600 members across the state, and we cover 60 of 67 counties in Florida. We have also a specialty plan named Clear Health Alliance that serves HIV and AIDS infected individuals in the state. Our goal is to provide healthcare and related services that are comprehensive, integrated, and patient-centered. And every day, members of our team can be found in Florida communities, listening to our members, interacting with our healthcare providers, and partnering with community-based organizations. Our goal is to ensure that members and entire communities are empowered to become active participants in their healthcare and sustain healthy lifestyles. We partnered with Mom Meals at the end of December 2018, and what our strategies with these programs are here at Simply Healthcare, and our objectives are to reduce risk associated with diabetes during pregnancy, which include and are not limited to decreased C-section rates, decreased delivery complications, NICU admissions, hospital admissions, ER usage, and to reduce preterm deliveries. Through different ways, we identify which are the members who meet criteria for the program. We enroll them and monitor them through the entire time that they are enrolled in our program. We deliver nutritious meals directly to the members' homes. We track progress with our members. Usually we, at least minimum, we contact them once a month to make sure that everything is running smoothly, to follow up with them, to make sure that they are following the dietary recommendations and any other thing that can impact the delivery outcome. Usually at the end of the year, at the plan level, we do our analysis and to track the outcomes of the program. How do we do it? We identified members through, like I mentioned before, through different ways, but mainly through claims. We have my advocate program, which is an IVR system who conducts telephonic outreach to our pregnant members to follow up with them and to provide education. We also use the inpatient census to determine which are the members who are being admitted to the hospital for any diabetes-related complication, but we might refer that person to this program if they have not been referred previously. And which are the members that we most find eligible for? The members with high risk, with history of preterm labor, preterm delivery, and high blood pressure. Also, members with gestational diabetes, history of gestational diabetes, or pre-existing diabetes. Like previously mentioned, we at least there should be a monthly contact, and that's based on the risk level. There might be some instances where the outreach call should be more frequent. As part of our plan benefits, those members who are diabetics, if the doctor orders it, we provide them with glucometer for tracking blood sugar levels, supplies, and insulin and or medications to control their diabetes. Also, at the plan level, we have a nutritional consultant who we refer those members with diabetes for additional support. According to the American College of Obstetrics and Gynecology and American Diabetes Association, it is recommended that for blood sugar levels pre-meals, it should be less than 95. 1 hour post-meal should be less than 140, and 2 hour post-meal, it should be less than 120. In our plan, we decided that for those members who will be receiving the meals, we allocated 2 meals per day for 10 weeks. So that makes 140 home delivery meals per member. And here are our results. In 2019, we referred 71 members to the program. They deliver 8,456 meals. The blood sugar levels, like you can see, they were within range. I need to point out that this was an average. Obviously, there were some members who unfortunately were not able to manage their blood sugar levels correctly, and there were some who were out of control, but most of them were within the desired range. For 2019, we had an engagement rate of 85%. We had 63 deliveries and 20 NICU admissions. Like you can see, in 2020, we made further progress, referring 115 members, delivering more than 14,000 foods. The blood sugar level remain within normal limits, obviously with the exceptions that sometimes happen that I mentioned before. The engagement rate compared to 2019 increased 2%. We had 103 deliveries, and NICU admissions were lower than 2019, which it represents a progress. These are the case managers that work with our members. After following up with them, they received feedback saying that the deliveries are timely, that the members have improved glucose control, they enjoy the food quality, choice, and convenience. And especially from this case manager, Sarah, she mentioned that she gets satisfaction at the end of a phone call when a member expresses her gratitude. Every time I hear thank you, I am rewarded. Thank you reminds me of my purpose within our program and the importance of us remaining available to the communities we support. So within this program, over the past 2 years, we have seen a 62% program growth, 2.4% increase in engagement by members, 38 decrease in improved blood glucose control, fewer NICU babies, 45% decrease, and fewer premature births with 41%. So by introducing meals that support blood sugar and blood pressure control, we have improved our pre and post natal outcomes within our high-risk maternal health members.
Great, fantastic. Thanks so much, Pedro. Just wonderful results there. And, we're, so proud to be a part of your program and really see that, grow and evolve over, the 2+ years we've been working together now, and, see the continued success for your members and, for your nurses who are working in the program and for your health plan as well. Great. So with that, I'm going to go over to the Q&A and take a look at a few of the questions that have come in. So we do have one question, and the question is for Pedro. How do plans successfully engage mothers to know that these services exist? So how do they find out about taking care of baby and me, for example?
We have several interventions in place. We have a bus program here in Florida just to make sure that we engage as many members as possible into the Taking Care of Me program. It is posted in our plan website. Also, once we here at the plan level, once we identify that there is a pregnant member, automatically they are mailed prenatal educational material and or postpartum according to the period where that particular member is. So one of the things that is included in the packet is advising them that we have this program. It's completely free, and anyone who is pregnant, which will be the main criteria to participate in, they are willing to do so. So they just simply call the plan and we enroll them in the program.
Great, wonderful. Thank you for that. Another question is for reporting blood sugars, because that was an important way to kind of determine, control during the program. How are the members reporting their blood sugar today? Are they talking about that by phone with their nurses? You kind of mentioned the IVR system. Are they kind of inputting the blood sugar into the IVR? How is that being recorded today?
The blood sugar levels are being reported verbally to our case managers during our monthly contacts.
Mm-hmm. Got it. Okay, perfect. Thank you. Let's see, I'm going to go out to Q&A again. Another person said, wow, a 45% decrease in NICU. Congratulations. That's great. Yeah, the results are fantastic. And another question just came in about receiving the slides. So absolutely, you can reach out to either myself or Julie at our email addresses here, and we're happy to connect with you and give you a PDF of the slide deck. Let's see, I'm just going to check one more time and refresh to see if there are other questions. Looks like those were our questions for today. So in conclusion, again, we would just like to, first of all, say thanks to MHPA for the forum today and all of the MHPA members who are really working in this very important area of maternal health. Thanks for attending and for thinking, creatively and innovatively about how to support your members. And thanks to Pedro for sharing their experience, their innovation, their success at Simply, and helping us all to learn about how how program success can come about. And thanks to Julie as well for your expertise and helping us kind of bring all this together today. So with that, thanks again for your attendance, and we hope to get back to in-person meetings someday, but we know during the current time still these virtual events are really critical for us to come together, network, collaborate, and share really important information. So appreciate everyone joining today, and we look forward to hearing from you if you have follow-up questions or have more interest. And with that, have a great afternoon, everyone. I'll turn it back over to you, Patrick.
Thank you, Catherine. That was very informative. And thank you, Pedro and Julie. As I mentioned before, Mama's Meals has been a longtime supporter of MHPA and our member health plans. This is a very valuable webinar. And yeah, no, Craig, my boss, President and CEO of MHPA, mentioned, he made a good point in the chat, 45% decrease in NCIU. Yeah, that's pretty amazing. So thank you so much for this great content. And yeah, speaking of being in person, we will be in person for MHPA 21, September 22nd to 24th. So we're looking forward to seeing Mom's Meals and our members together. But with that, yes, we'll go ahead and close out the webinar. We'll put this recording on our YouTube page. You'll receive a link to that. And of course, as Catherine said, if you want the slides, please feel free to contact them or me. We'll get them to you. And you'll be on the lookout for more webinars. We'll email you, and they're free, of course, and happy to bring that service to you. Everyone have a great afternoon. Thanks again.
Thank you.
Thank you.
Thank you. Bye-bye.